We have a really important OBGYN women's health question here, which frequently shows up on exams and has a lot of important information, so stick with me. We have a 25-year-old primipara woman who is in labour. The fetus is in the cephalic presentation, meaning that the fetus is head down. The head is engaged, meaning with the pelvis. The uterine contractions are 2 per 10 minutes, which is quite weak. At 5 a.m, the cervical dilatation is 4 centimeters, and at 9 a.m, it is 5 centimeters. So in about 4 hours, we've had 1 centimeter of dilatation. The membranes ruptured earlier that morning. The posterior fontanelle was felt, and there is no caput or molding. Remembering caput is where we have swelling of the scalp, and molding is where we have crossing over of the fetal skull bones. The vertex is felt 1 centimeter above the ischial spines, meaning we are at station -1. The pelvis is adequate, and the fetal heart rate is 140 beats per minute, which is normal. So it's asking what is the best management option for this. So first of all, when we're thinking about this question, we need to think, what stage of labor is this woman in? So this woman is in the first stage of labor, and then we have the latent phase and we have the active phase. So the latent phase, remembering, is when we are 1 to 4 centimeters of cervical dilatation. So we can clearly see here that now she is in 5 centimeters. So she is in the active phase of labor. So then we need to think, is labor progressing normally? So in this case, she has progressed. She has had 1 centimeter of dilatation in the last 4 hours. So when we are in the active phase of labor, we should be having 1 centimeter of dilatation every hour once we enter the active phase. And in order to diagnose a delayed progress of labor, we would need the rate of cervical dilatation to be less than 2 centimeters in 4 hours, which is what we have here. We only have 1 centimeter. So we can diagnose delayed progress. We then need to understand why. And this is probably due to inadequate contractions. So we can't see any other reason. The baby looks healthy, mum looks healthy, there's no obstruction. So if we're thinking about then, if we go from the bottom, if we're thinking about E, perform an emergent cesarean section, so this would be really premature. As I said, the baby's fine, heart rate's fine, no caput or molding. So it would just be premature to do that now. D and C, so administering IV fluids and continuing fetal heart rate monitoring. This is supportive care. As we mentioned earlier, we've diagnosed delayed progress, and the membranes have ruptured. So first of all, supportive care wouldn't be the correct answer, but also supportive care should be done for all cases of prolonged labor, plus whatever else we're going to do. And also, this may actually, if we just observe for another 4 hours, because the membranes have ruptured, this can increase the risk of the mother having infection like chorioamnionitis. B, commencing an epidural analgesia. So this would be incorrect. This is mainly just due for pain. So this woman isn't, what we can see, she's not in that much pain. It can also actually prolong the first stage of labor, which is what we don't want here. And then obviously we have A, which is the correct answer, which is an infusion of oxytocin or syntocinon, which is artificial oxytocin. Remember, it acts on the myometrium, the smooth muscle, or the uterine smooth muscle. It is typically given when we start low, and then we titrate up to the amount of uterine contractions. So the uterine contractions right now are quite low at 2 per 10 minutes. We want to get up to 4 per 10 minutes or even 5. So you just titrate it upwards and you base it off the amount of uterine contractions. It's important to note here as well that if the membranes were not ruptured, we would rupture them first. So you would do an artificial rupture of membranes, and then you would do the infusion of oxytocin or syntocinon. Remembering that syntocinon will improve the strength of the contractions and the number of contractions. So a really important question here, lots of high yield points, really important for AMC. So I hope you guys enjoyed.